Hey guys, my name is Dr. Jeff Ping. I recommend my patients be extremely aggressive in treating their frozen shoulders. And that's because if a frozen shoulder is left untreated, it can take up to 3 years to resolve on its own. So in this video, I'm going to show you the best stretches to help treat a frozen shoulder. Now, if this is your first time watching one of my videos, my goal is to help each and every one of you live a healthy and active lifestyle. So if that's something you're interested in, please consider subscribing to my channel. Frozen shoulder is caused by scar tissue formation around the shoulder joint, and it progresses through 3 phases. The first phase is the freezing phase. This phase can be extremely painful and can last up to 9 months. The second phase is the frozen phase. This is where people feel stuck. This phase can last about 12 months. The third and last phase is the thawing phase. During this phase, range of motion and mobility slowly improve, but shoulders can still be painful. The third phase can last up to 12 months. So now you can see why I recommend being extremely aggressive. Nobody wants to spend almost 3 years waiting for their frozen shoulder to thaw out. Aggressive treatment can significantly speed up the timeline and shorten the duration spent in each phase. That's why I recommend a combination of a shoulder joint injection, physical therapy, and an aggressive home stretching regimen. This video is going to focus on the stretching regimen that I have my patients do at home. The goal is to do each stretch for 1 minute. With that said, if all you can do is 20 or 30 seconds, that's fine. Take a break and then get back into the stretch. Build yourself up to 1 minute. You'll want to do these stretches at least 3 times a day in order to put constant tension on the scar tissue in the shoulder joint. The more you do this, the better and the quicker the results. So the first thing we're going to do is a warm-up. Now, warm-up is incredibly important for people with frozen shoulder because remember, the problem with frozen shoulder is that it's stuck. So anything that we can do to warm them up to try to loosen it, so when we get into our exercises, you're going to have more mobility to try to push and stretch out all that scar tissue. So the first thing we're going to do is just shoulder rolls. So 10 forward, just like this. Now again, if you can only start with 10 smaller circles, that's okay, but slowly work into bigger circles, and then 10 backwards. And then what you also want to do are some scapular squeezes, so this motion. And then once you got a good warm-up, so just do 10 of each, then we can move on into our exercises. Now for these next set of exercises, you're going to need some type of stick. Now I have a PVC pipe here, but you can use whatever you have at home. It could be a broomstick, it could be a yardstick, it could be anything long, but it's something that you need to push into these stretches. Now you're going to want to push yourself every time we stretch. This may cause some discomfort, and a little bit of mild discomfort is okay, but you shouldn't be pushing yourself to severe pain. So on a scale of 1 to 10, with 10 being the worst pain, we're aiming for around 1 or 2 out of 10. Okay, so the first movement we're going to do is a forward flexion, which is just a straight up forward arm raise. Now, what you want to do is you want to stop where you feel that 1 or 2 out of 10 pain. So if that's over here, okay, stop there. If it's over here, that's where you want to stretch to. So what's really important is your left arm is actually doing all the work. Your right arm is just going along for the ride. And so what you want to do is just slowly lift up, and wherever you start feeling that 1 or 2 out of 10 pain, you just hold it right there. And you want to hold it for a total of 5 to 10 seconds. And after 5 or 10 seconds, relax. Take 1 or 2 second break, and then get right back into it. Try to push it. Every time you do this, try to push it a little bit farther, and hopefully day by day, over the course of many weeks, your range of motion is going to slowly improve back to that 180 degrees. So the first way of doing it is using your arm, your left arm, and then just slowly bringing your right arm up. Now the other way of doing this is to actually push your right arm up. So you can hold your stick like this, put your right arm on top of it, and then push it up. And then wherever you start feeling that discomfort, hold there. Hold there for a total of 5 to 10 seconds. Initially, when you're still having that bad pain, 5 seconds might be the maximum time you can do this. But if you can do this 10 seconds, 15 seconds, that'd be really good. And just push yourself. Push yourself every single time you're doing this. Push yourself a little bit higher to restore that range of motion. Remember, we're going to do this for a total 1 minute for each exercise. So the next motion we're going to do is a side raise, and this motion is called abduction. And so just like with forward flexion, your affected shoulder is not going to do anything. It's just going along for its ride. So for me, my right shoulder, my right hand palm facing out, and my left arm is just pushing it out towards the side. And I'm just going to push it to where I start feeling that tension, and I'm just going to hold it there for a total of 5 to 10 seconds. And then we're just going to bring it back down and rest, and then push it back out for a total of 1 minute to slowly put even more tension on all that scar tissue. Now, just like with forward flexion, if this is too uncomfortable and you'd rather put your hand on top and use your left arm and push it out, that's also an option, whatever is most comfortable for you. Okay, so we also want to work on extending our arm or moving it backwards. So just like forward flexion, when we try to extend our shoulder, we want to hold on to our stick and then just bring it backwards. And again, just find where it starts feeling that uncomfortable feeling and just hold it there. And hopefully over time, we can get higher and higher and higher. So you can do it this way, or if you prefer to push, you can hold the pipe with your other hand and then push it backwards. And wherever you start feeling that discomfort, hold that and then bring it back down. Okay, so the last two exercises we're going to do are both focused on rotating the shoulder. And unfortunately, it's the rotation, so external rotation and internal rotation of the shoulder, that are the last movements to come back when your shoulder finally thaws out. So these are going to be extremely important. And so just like our other movements, what you want to do is you want to hold on to the stick, and then you're just going to be rotating outwards. And so I'm using my left arm, or the unaffected arm, to slowly put tension and rotating the shoulder out. So you want to start with 90 degrees over here. Keep your elbow at 90 and your shoulder relaxed, so 90 degrees here. Hold on to the stick and then just slowly using your other arm and pushing it and rotating it out. Now, most people are going to be stuck around 30 to 45 degrees, and if this is as far as you can get and this is as far as you're pushing, you're already feeling the tension here, good, keep going. And the goal is to be able to get you far out as your unaffected shoulder. And so just pushing it, putting on more tension day by day. Relax, hold that for 5 to 10 seconds, relax, and then start pushing it out again. Okay, so the last exercise we're going to do is working on internal rotation of the shoulder. And internal rotation is going to be this motion. Now, a lot of people with frozen shoulder, this seems almost impossible. And so if this is as far as you can get, that's where I want you to start. Some people is at the outside of the hip, some people it's towards their back pocket, some people it's at the base of their spine, and some people can get a little bit higher up. It really depends on where you are in the frozen shoulder course. And so if this is as far as you can get, so towards the outside of your hip, you want to bring your stick down and grab onto it. And your right shoulder is not doing anything. The affected shoulder is not doing anything. It's the unaffected shoulder that you are slowly pulling up. And so you're pulling the right shoulder up and internally rotating it. Now again, if you're starting here and when you start pulling, this is as far as you can go, this is where you're feeling that tension, perfect. Just hold this for a total of 5 to 10 seconds, relax, and then get back into it. And hopefully over time, you're going to be able to slowly, more steadily increase that range of motion, getting it higher and higher. Remember, being diligent about doing the stretches and exercises anywhere between 3 to 5 times a day is by far the most important aspect of treating a frozen shoulder. If you found this information useful, please consider liking and sharing with others. Thanks, and I'll see you next time.